Hello, everybody. My name is Elisabet Wentz. I'm a psychiatrist and associate professor in Gothenburg. And good afternoon. This paper is made by myself and my colleague over here, Britt Hedman Ahlström. And I'm going to present internet-based support and coaching, habilitation of young adults with autism spectrum conditions and other neuropsychiatric disorders. And it's a pilot study. And the objectives: to develop a model for internet-based support and coaching. And what I mean by that is mainly a chat function and an email function on an internet program. And this is for young adults with autism spectrum conditions and other neuropsychiatric disorders. Actually, it's only ADHD as well. We also tried to recruit individuals with Tourette's syndrome, but we couldn't include any. And the other objective is to increase the knowledge of these young adults by analyzing the chat logs and interviews with the coaches. And the participants in this pilot study, they were between 15 and 25 years, and they had autism spectrum condition, ADHD, or both. And we recruited them from the Child Neuropsychiatry Clinic at Queen Silvia's Children's Hospital in Gothenburg in Sweden. And what characterizes these participants? Well, they are in need for support from parents, even in young adult years, in a much larger extent compared to other young adults. And when they have finished school, for instance, senior high school, the structure disappears, and it's very obvious for this group. They don't know what to do and how to handle their situation. And all these participants also have weak executive functions, and that can lead to passivity. This is an illustration of the flowchart, what we are doing actually in this pilot study, in the project. It starts with inclusion, and that's an interview, and also that the participants complete self-report questionnaires. After that, they have a meeting with their coach. The coach is a psychologist or an educational therapist working at our clinic. And together with the coach, they decide what goals they want to have with internet-based support and coaching. And it can be one goal, or preferably 2 or 3 goals that they can work with. And then during this 8-week period, they will have this internet-based support and coaching. And what it means is that they have a chat contact with the coach twice a week, half an hour to an hour each time. And in addition to that, they also have 2 visits at the clinic, because we know from other internet-based treatments that it's not enough to have contact over the internet. You need also face-to-face contact. And for instance, if one of the goals that you wanted to work with is already achieved, then you can discuss with your coach what new goals you want to work with over the internet. Finally, after the 8-week period, you have an interview with the patient about how they perceived the internet-based support and coaching. They also fill in the self-report questionnaires again, and at 6 months later, they also complete the self-report questionnaires. And what methods or instruments have we used? Well, first at inclusion, we use interviews. And we use parts of the SCID-1, and that is pertaining to psychiatric disorders, because we need parts of that interview to exclude, for instance, current psychosis and current substance abuse. We also use parts of SCID-2 which pertains to personality disorders, to exclude conduct disorder, a current conduct disorder, and current antisocial personality disorder. We don't believe that these patients can have, for instance, a current psychosis and have it be chatting on the internet. And the self-report questionnaires. We use them at inclusion, after the 8-week period of support, and 6 months later. We're interested in quality of life, and we use a scale called the MANSA. We are also interested in the self-esteem, if that can change over time, and we'll use the Rosenberg's self-esteem scale. Further, we look at anxiety and depression level, and for that we have the Hospital Anxiety and Depression Scale, and also specifically for depression we use the MADRS, and it stands for Montgomery-Åsberg Depression Rating Scale. And finally, we also look at sense of coherence using the instrument called SOC. Other instruments used. Well, after the 8-week period, we have this semi-structured interview with the patients, because we are very interested in how the patients perceive this kind of support. And we're also interested in the next of kin, usually the parent or perhaps a partner or a very close friend, how they perceive if the patient has changed during the period of support. So we use that self-report questionnaire at inclusion and after the 8-week period of support and 6 months later. This is an illustration. Sorry, it's in Swedish. But this is the welcome page for the chat. So this is what the patient actually, the program that the patient is using, and also the coach. And here are 2 links. That one for the chat. They click on that and they reach the chat. And the other one is for an email function. And we have collaborated with a Swiss company who developed the program, because they're very used to make internet programs for healthcare, and mainly they work with eating disorders. And we have chosen this company because they have a very high level of security, which is very important.